TMJ is commonly called in the public TMJ. That's the temporomandibular joint, this joint. But in dentistry, we talk in terms of TMD. TMD is temporomandibular disorder. And so we find it's a disorder. And it is an area that I have a lot of training in. I've spent a lot of hours. I've gone to an institute where I took hundreds and hundreds of hours to graduate this institute, learning about TMD and how to help patients with their jaw and their bite. The philosophy that I believe wholeheartedly in is called neuromuscular dentistry. We try to find a balance, not just with the teeth, but with the muscles and the joint, and try to build everything in harmony. It's very common in our society. Stress has brought out a lot of trouble with teeth, and patients live longer. Patients have a lot of stress in their life. Accidents, another big problem that we see is braces. Patients having braces early in life, and it's not for everyone, but for certain individuals, if they move those teeth out of balance, yes, they might be straight, but now they're not working in harmony with the muscles. Then we have patients that are developing TMD. With our TMD patients, they may or may not have joint clicking. They often have headaches. That's usually what they're coming to me for. Or they have a lot of neck strain and even down into the shoulders. And we find as we go through our therapy and our treatment, as we restore that balance back into how one jaw relates to the other, these symptoms start disappearing. You get rid of the noises here, you get rid of the headaches, you get rid of the neck problems and the shoulder problems, and the posture becomes better. And we have different ways, I have different ways that I treat that. And usually we're gonna start with something very conservative. We don't wanna go in and do anything to their teeth to change. We wanna do something usually with the use of a splint, a plastic splint. We call it an orthotic. Just like you'd put an orthotic in your shoe to give you better posture. Well, we're gonna put an orthotic in over your teeth, that's removable, that will help me start understanding where your bite and where the balance of your jaw should be.